Welcome to Shobbs Health and Wellness section. My name is Bakare Olubukola. On this episode, I'll be talking about oral health and risks of poor oral hygiene. Oral health is the practice of keeping one's mouth clean and free of diseases. I'll be focusing on oral care routine and oral tips, natural mouthwash that could be used, and some systemic disease that could arise as a result of poor oral hygiene. I know we are conversant with the regular way of keeping the mouth clean with the use of a toothbrush and a toothpaste, but it goes far beyond that. As we all know, the oral cavity is the first contact of the body, and so we should take care of the mouth like we would take care of our skin, our face, and other parts of the body. So what are the oral care routine that should be practiced? Brushing the teeth twice daily with a soft bristled toothbrush, starting from the back. So it is ideal, it is right for us to start brushing the teeth from the back, then to the sides, then to the front. Using a tongue scraper daily can help desensitize the mouth gag reflex. Daily scraping can also improve the sense of taste while eating. So it is advisable that we scrape the tongue daily in order to improve the taste bud. Swapping spit can throw off the oral pH, so making use of xylitol mints after kissing is advisable in order to help restore the mouth pH. The mouth pH is slightly acidic, so if it goes beyond this, it could cause a complication or some systemic disease, which I know we wouldn't want that to happen. Also, brushing the teeth before being intimate can increase the risk of infection, so the use of an antiseptic mouthwash is preferable. So it is preferable we use a mouthwash that is an antiseptic mouthwash instead of brushing the teeth if we want to become intimate, if we want to kiss our partners. Also, flossing the teeth every day is advisable because our toothbrush can't get into some tiny holes of the teeth. So it is advisable we use a floss. A floss is a fluffy, fibrous material that we can use. It's tiny and it's fibrous in nature. So we should use it into the tiny particles of our teeth in order to get rid of some food particles that can store inside the mouth. Also, there are some things that we should stay away from in order to get a healthy mouth and a healthy gum. Avoid sugary food. This cannot be overemphasized because sugary food can combine with the bacteria and the saliva in the mouth, which causes plaque, and this plaque can dissolve the enamel. This plaque will dissolve the enamel and it will cause cavity. Cavities are holes, so if the plaque dissolve the enamel, the cavities that gradually there will be formation of hole within the mouth, and this will give the bacteria a good medium for it to proliferate. Also, avoiding tobacco products because it affects the enamel, which we wouldn't want that to happen. So what are mouthwash? Mouthwash are liquid disinfectants which are used to disinfect the mouth and also freshen the breath. I'll be sharing with us natural mouthwash that can be used, which can be gotten at home. It is easily affordable and available at home. So the first one is apple cider vinegar. How do we make use of this apple cider vinegar? You take 1 spoon of apple cider vinegar into a cup full of distilled water, then you use it to gargle, rinse the mouth. Also, the use of baking soda. It is advisable we use a spoon of baking soda into a cup of distilled water and adding 3 drops of essential oil. There are various essential oils that can be gotten. We have the cinnamon, clove, peppermint, tea tree oil, or wintergreen. So you can make use of any of this. I guess tea tree oil is easily available. So you can make use of 3 drops of tea tree oil into a cup with the baking soda. Then you use this to gargle. You swish around the mouth. This can be used as a natural mouthwash. Also, coconut oil. Coconut oil kills bacteria due to its large amount of lauric acid. So you take a teaspoon of coconut oil into the mouth. You swish for 15 to 20 minutes. Ensure that the oil goes through the mouth, through the spaces in the mouth. This also acts as a mouthwash. Also, the use of aloe vera gel. You can make use of aloe vera gel as a mouthwash, as a natural mouthwash. So instead of brushing the teeth before being intimate, you can make use of mouthwash. You can also make use of this mouthwash daily. This mouthwash also can be preserved, like your apple cider vinegar. If you get a whole jar, so in the morning you take a teaspoon of this apple cider vinegar, you put it into a cup, then you gargle it. So you store the other one. So what you make use of daily, it's a little quantity, so you can store the others. So moving on, I'll be talking about the systemic disease that could occur as a result of poor oral hygiene. We know if the gum is not properly taken care of, it leads to some diseases such as gingivitis, halitosis, and oral thrush. All these can cause systemic disease. Systemic diseases like respiratory infections, diabetes, oral cancer, cardiovascular disease, and kidney disease. You want to know how gum disease causes respiratory infections, right? If the gum is being infected with bacteria, there's a likelihood that we breathe in this bacteria. So this bacteria goes through the respiratory tract, down into the larynx, the trachea, then into the lungs, and it causes accumulation of fluid, which in turn reduce gaseous exchange, which impairs lung expansion. So when there's fluid within the lungs, it is impossible for the lung to expand. It is impossible for the lung to carry out its gaseous exchange. So you see how as tiny or as little as gum disease can be, it can cause respiratory infection. Also, gum infections can cause cardiovascular disease. The bacteria from the mouth can enter the body via the blood system, that is through the bloodstream, and cause the arteries to harden and can cause problem with blood flow and blockage of the heart. So this bacteria can move through the bloodstream, go straight into the arteries, then cause problem with blood flow within the heart. As tiny as the bacteria within, as tiny as gum infections, or as minute as we see gum infections are, they can cause a whole lot. It can also cause oral cancer. It can also cause kidney disease. People with gum disease have a weaker immune system, which can lead to chronic kidney disease. There's a whole lot associated with gum disease. So I would employ us to take cognizance of our health, oral hygiene. Most of us, all we do is, I guess I'm a victim too, until I started researching about this. All we do is brush the teeth only in the morning, then we go on. There's a whole lot, like I've said, there's a whole lot we should practice daily. Mouthwash cannot be overemphasized because they help disinfect the mouth. Use of mouthwash, scraping the tongue, all these cannot be overemphasized. So that will be all on today's episode. If you have any question for me, please drop your questions on the comment section. And what else would you like me to talk about? If you want me to talk more about the systemic disease that are associated with gum infections, please drop it in the comment section. Thank you for listening, and I'm sure we will all practice this method that have been said now. Thank you for staying tuned and have a lovely day. Bye.